Brandy Riffe. I am doing a IV start. I would use my general principle and safety practices, doing my 11 rights and 3 checks, using my two patient identifiers, and assessing my patient for any allergies. Knocking and introducing myself to my patient and doing hand hygiene as I come in. And so I would get my IV solution and I would open that, and then I would get my IV tubing and I would open that, keeping them with the aseptic technique. So I'm going to get ready and spike my bag. I would make sure that my tubing is not pinched, clamped, or damaged anywhere, and that the dates and everything is good on my solution. Okay, so I am going to remove the end, not touching the tip, and I am going to remove the cap off my spike, not touching neither. And I'm going to spike my bag using a push twist, not touching either end, keeping them sterile. And I'm going to fill my drip canister halfway. I'm going to hang my bag, allowing my tubing to fill, twisting my end cap just enough so that I can let out any air and allowing my tubing to fill fully. And letting that drip so that I know that there is no air. So then I'm going to keep that cap on there, and I am going to lock my line. So I am going to put that to the side for now, keeping it sterile. I am going to get my J-loop and I am going to open it, revealing the hub side, not touching the other side. And I am going to get alcohol prep pad and I am going to scrub the hub, and I am going to open my flush, and I'm going to screw my flush onto my J-loop, and I am going to flush my J-loop, priming it, and I'm going to leave that in the package so that that is ready for me. I'm going to assess the vein I would be using for my patient, and I would perform hand hygiene before starting the IV. So I'm going to don my gloves. And I am going to open my IV start kit. I'm going to open my IV catheter. I have my tourniquet ready. I'm going to clean the site with I'm going to clean the site with a facility approved solution. And I'm going to apply my tourniquet 3 to 4 inches above the site. And I'm going to feel the radial pulse, making sure that that is still well. Now I'm going to get my IV catheter using the OK motion while that was air drying without touching it, keeping it clean and sterile. I am going to start my IV, and so going in at a 10 to 15 degree angle. I am going to insert, keeping the area clean and sterile. I am going to insert the IV until I see a flashback of blood, and then I can advance the catheter, pulling back, pull my tourniquet while applying pressure, and stabilizing my catheter. Then I can engage my needle without touching my site, and I can apply my J-loop, keeping all of that sterile. Okay, so now I can let go of the catheter because I have the J-loop holding it. That is already pulled, and I can apply my Tegaderm. To keep my catheter in place. So now I can pull back for a blood return and flush while I assess for any sort of complications with my IV site, any sort of infiltration or anything like that. And that all looks good. So I would then label my IV site. Putting my sharps in the sharp container and disposing of any trash that I need to. And I would use tape to secure my J-loop. Now I will get an alcohol wipe, and I am going to scrub the hub so I can connect my IV. So I am going to scrub the hub, keeping it up and off now that it is scrubbed and clean. Remove my cap, keeping that from touching anything, and placing it onto my hub and screwing that on tightly. Securing that down with tape. And opening my lock so that my IV is flowing at the rate that is ordered, making sure to assess the IV site for infiltration. Everything looks good. I would come back and assess my patient to make sure that they are not having any sort of reactions, and make sure that everything is responding as appropriate, I would remove my gloves. I would do my hand hygiene, and I would go and report and record and come back and assess my patient as often as needed to make sure everything was done or make sure they was handling everything as needed. Thank you.